So what a wonderful opportunity, Dr. Sakthi, to have your words at our Synod today. I've expressed our gratitude to you for your leadership through the pandemic years that are still kind of with us. How would you summarise what we've learnt in the last couple of years about the health across Lancashire, maybe some of its inequalities? Let's start with that, really. What would you say we learnt through this last 2 or 3 years?
Well, it's a pleasure to be with you. And one of the main things we've learned over the last couple of years is at times of crisis, the underlying vulnerability that is present in our society became more pronounced and more visible directly to us. You may be living on a very low income, maybe living on your own, maybe living in a very bad, poor quality housing, and not able to look after yourselves. That's what became much more clearer, and that was one of the most important things that we learned. And how do we identify them? How do we support them at times of need? We are taking that lesson going forward much more robustly and strongly.
And during that time, we've been talking at an event this evening about the power of community. What did you see happening in local communities, and perhaps particularly in this context, faith communities, churches and others?
Oh, if there is one thing that's in abundance in Lancashire, that is the care and compassion that we show to each other between society, members of our communities, neighbours, places of work and worship. Things that may look very simple. Are you okay? Asking that. Are you really okay? Can I help you in any way, shape or form? Even small cups of tea and just knocking on door to see if I can get you shopping. Those small acts of kindness were great offers of help at times of need. That's what we saw in abundance across Lancashire.
And so we're anticipating a wave of need that might be even more acute over the next few months. Our Synod this Saturday is all about enriching communities, and we've heard a call tonight to have greater confidence that the little coffee morning that we run is actually a very powerful tool for connecting people, helping people's mental health, well-being, combating isolation. What would you say to a group of Methodists from across Lancashire to prepare us to serve our communities well over the coming months?
I think the coming months are going to be pretty challenging for many of us across Lancashire, with an anticipated rough autumn and winter, along with the rising cost of living. The main risk to us would be keeping ourselves warm, well fed, and checking in on each other and helping out each other. So those small things that you may think you're doing as very small things, like the coffee mornings or small choirs and singing clubs, those are real lifelines for our well-being. And you can be more than confident by thinking that those small acts go a long way in keeping someone well and checking if someone's safe. So please don't think that they are small. They are actually huge contributions that you're making in keeping our county safe, healthy and well during times of need.
Thank you. I'm just going to push on one more question. We were sensing from our conversation this evening that there is a greater openness from the National Health Service, from local authority for these creative partnerships. Are you seeing that? And is this a good time for churches to be fully engaging as much as they can with local authority and the National Health Service?
Absolutely. There is an even greater understanding amongst health professionals, people like myself, the role of wider community, wider faith groups in keeping people well and improving our health and well-being. And there are lots of changes happening within the National Health Service and the way that we organise care for our residents. And a fundamental part of that is fully engaging with communities and fully exploring and deepening collaboration across sectors to keep our NHS really flourishing and viable, but also support people with their wider needs to cater for their holistic well-being needs, physical, mental, social, and spiritual well-being. So there's an even more wide open door for forging better collaborations with particularly faith sector.
Dr. Sakthi, thank you so much. And can I assure you of the prayers of the Methodist people of Lancashire for yourself and for your team. We have a great respect for the National Health Service under enormous strain and pressures. And with your leadership, we'd love you to know that we're thinking of you and praying for you through the coming months and years. Thank you for your time.
Thank you for your prayers and wishes. Thank you.
Brilliant.